So, one of our readers, or viewers, Shane Creamer, sent in this question. It was about a video on coconut oils. And the question is, Dr. Brewer, have you seen this research that shows that all separated oils cause endothelial insult to arteries within 1 to 3 hours of consumption? Do you think the study was well designed? All the major oils were tested. And then it gave the NCBI PubMed reference. I'll put that reference in the article. Actually, I'm going to review that article today. It's a great article regarding olive oil. It does touch on some of the other oils, but much better focus on olive oil and some comparison in terms of olive oil in terms of supplements versus putting it in the diet, and the impact of olive oil on inflammation, as well as looking at dilatation. It's a thing similar to endopat, where you're looking at you're trying to judge potential injury to the endothelium by dilatation and flow measure. But before we do, a brief introduction. Ford Brewer, F-O-R-D, Brewer, B-R-E-W-E-R. Prevmed, preventive medicine. Started in emergency medicine and got very upset with the damage to humanity coming into the ER, and went to Johns Hopkins to get some focus on prevention. Anyway, so we're going to go into this article, and first of all, talk about a couple of things. Number one, was the study well designed? This study was very well designed. Just a couple of references on the study. The title is Effects of Olive Oil on Markers of Inflammation and Endothelial Function, a Systematic Review and Meta-Analysis. So you remember, a meta-analysis is where you're going out and taking other studies, usually randomized clinical trials, and doing what you can to pool all those randomized clinical trials into a larger study. There are rules for that, and there is an agency, an international nonprofit group called the Cochrane Group, C-O-C-H-R-A-N-E. The Cochrane Group has developed a huge set of guidelines around how to do. Sorry, pardon me again. More bad graphics on my part. The Cochrane study has developed a series of methods on how to do a good meta-analysis. And to just let you know, bottom line is these guys did a great job on the meta-analysis characteristics and methods. The study was published in the journal Nutrients, September 2015. The authors were Schwing-Schackel, Christoph, and Hoffman from Vienna. Now, so that's some of the basics on the article and the citation itself. I've went through it, underlined it. So here's some basics on this article. They used the Cochrane Clinical Trial Register, Embase, and Medline. They found 30 studies out of 3,106 participants, which fulfilled the selection criteria. So this is a fairly large study. The olive oil interventions, here's the punchline. For those of you who don't want to get into the detail, I'll just give you the punchlines real quick. Olive oil interventions caused a decrease in C-reactive protein. Again, the probability of this happening on a random event was less than 1 in, 1,000. So a good statistic there. Impact on interleukin-6, probability of less than 1 in, or 4 in 100. So not quite as strong a signal on interleukin-6. Flow-mediated dilatation, significantly more increase with these individuals. Probability of 2 in 1,000, probability less than 2 in 1,000. And so again, provide more evidence that olive oil may exert beneficial effects on endothelial function, as well as markers of inflammation. So thus representing a key ingredient contributing to the cardiovascular health effect of the Mediterranean diet. Now then, I'll go into some detail for the geeks that are interested in the study itself. They go in to talk about the key ingredients of the Mediterranean diet. They've done other research. They're looking at, what could it be? Could it be olive oil? And if so, which components of olive oil? They also are looking at what form of olive oil? Supplements, just putting it in the diet, and if supplements, what kind? Again, in some of these studies, they did compare this to other oils, but Shane, I didn't see a lot of clarity in terms of the comparison to the other oils. What I will say is that, you look at some of the other oils like coconut oil. I don't think those other oils are set up or are supposed to have the same impact. I'm not surprised that you would see, whether you would or would not see an immediate impact on endothelial function with coconut oil, for example, like you might with olive oil, but still maybe see some impact, positive impact with coconut oil. I'm realizing I probably need to go a little bit deeper in terms of potential mechanisms of function with coconut oil. Now, again, for the literature research, they went into detail. They used a Cochrane trial register. They looked at Embase, PubMed. They looked at different literature associated with C-reactive protein and the flow-mediated dilatation measurement. They looked at study selections. They did a very good job of delineating what types of studies they were looking for, what were the components of the studies. The Cochrane analysis has a lot of good information and methodology regarding how to assess risk. They did an excellent review on risk of bias in the study. That's how they ended up deleting a lot of these studies. Good discussion on data abstraction and analysis. And let's go over to the end. The duration on this, by the way, for those of you who are wondering, was between 4 and 208 weeks. So again, we're not talking about what you see over the next 10 minutes after ingestion. They did do some analysis and discussion regarding the markers they looked at. For example, they looked at C-reactive protein. They didn't look at what I consider to be the most important indicator of inflammation. That would be the microalbumin-creatinine ratio. They did look at interleukin-6. As you probably know, if you're still hanging on at this point, there's still debate regarding the best measurements of inflammation out there. Won't go in any deeper into that discussion about measurements of inflammation. C-reactive protein is clearly a good one. Let me see if there's anything else in this study that I think is worth commenting on. Yes, in their own discussion, as I mentioned, they said, maybe there are some specific components of olive oil that help to create that positive impact. And they go on to mention the phenolic compounds in extra virgin olive oil and the oleic acid. They end up with some discussion like any good researcher would do, talking about, okay, what are the downsides? What are the weaknesses in this article? And again, they do a good job there. I won't take up more of your time going into detail on that. But thank you very much, Shane Kramer. This was a great article, and I think it provides some very good clarity regarding inflammation, cardiovascular inflammation, endothelial function, and olive oil.